The vest airway clearance system from Hillrom Respiratory Care was developed to provide effective airway clearance therapy to those in need. When used as part of a daily treatment plan, the vest system provides a safe, effective therapy that is non-invasive and can be done in the comfort of your own home, clearing the way for better days. This tutorial program is designed to give you a basic overview of the features and functionality of the vest airway clearance system, including basic setup, use, and maintenance of the device. For additional details and information, please refer to your Model 105 User's Manual or visit hillrom.com. The vest system consists of an inflatable garment attached to an air pulse generator. Together, they deliver a type of therapy known as high-frequency chest wall oscillation. Through rapid inflation and deflation of the garment, the chest wall is gently compressed and released, which creates airflow within the lungs. This process moves mucus toward the large airways, where it can be cleared by coughing or suctioning. Getting started is simple. It all begins with ensuring that your vest garment has the proper fit. Hillrom offers a variety of garments, all of which provide adjustable tabs or closures so that you can adjust to your body. For added comfort, it's recommended to wear a single layer of cotton clothing underneath. The C3 garment line is made of a durable brushed fabric that is soft to the touch and available in a variety of colors and patterns. Both child and adult sizes are machine washable and dryable. When your C3 garment arrives, you will see that there are two separate pieces, the outer garment and the inflatable bladder. To assemble them, start by laying the outer garment on a flat surface. Open the zipper at the bottom and insert the inflatable bladder. Next, pull the air hose ports through the outer garment. Secure all snaps so that the bladder and outer garment are snapped together. Lastly, close the zipper at the bottom and your vest garment is ready for use. Adjust the shoulder straps so the arm opening is just beneath the patient's underarms. Using the front closures, hold the buckle and pull the end of the strap to adjust the garment to fit the body closely without being uncomfortably snug. When deflated, you should be able to easily fit a fist in between the garment and your chest. If you need to loosen a closure, gently lift on the back of the buckle and lengthen the strap. When fitting the classic wrap vest, start by positioning the deflated garment perpendicular to your torso. With the top edge just below the underarms, pull both ends around your chest. Take a deep breath and attach the ends of the garment. This will help ensure a close but comfortable fit. The deflated wrap vest should be loose enough that a flat hand can fit between the garment and the body, yet tight enough not to slide down before inflating. For this particular garment style, the hose connector ports can be positioned wherever you feel is most comfortable. For instruction on the fitting of other garment types, please consult your user manual. Once your inflatable garment is securely fastened and fitted properly, it's time to attach the air pulse generator. Make sure it's placed on a dry, stable surface near a grounded power outlet. This is important to prevent personal injury or damage to the device. Align the marks on the interchangeable air hoses with the corresponding marks on the connector ports. Gently insert and turn to the locked position. If you have non-locking air hoses, please refer to your user manual for proper setup. Plug the power cord into the back of the air pulse generator and plug the power cord into an applicable power outlet. Then, connect the air hoses to the ports on the inflatable garment. Push and slightly twist the air hose ends into the connector ports to help secure them into position. It is important to make sure all air hose connections between the garment and the pulse generator are set and secure before initiating therapy. Failure to do so could result in personal injury or serious damage to the equipment. Before beginning treatment, it is important to ensure your inflatable vest garment is properly fitted, securely fastened, and all necessary connections to the pulse generator have been made. You're now ready to begin your airway clearance therapy. Once power is connected, the unit will show a blank screen for up to 15 seconds. Once the screen is illuminated, it will show the model number, the total number of hours it's been operated, and the software version currently installed on your device. This information will be needed when programming the advanced functions of the VEST system. Consult your user manual for more information on setting up custom therapy modes. Normal mode uses a single frequency, pressure, and time setting for the entire therapy session. To begin the standard normal mode, press the up arrow button above Normal. The display will then show the 3 key therapy settings on the device: frequency, pressure, and treatment time. These could be either factory presets or settings programmed by your clinical trainer. Use the up and down arrows to adjust these numbers to match the prescribed treatment plan from your physician. These settings can also be modified while treatment is underway. Once the desired therapy settings are displayed, press the On button and the vest garment will inflate. It is helpful to hold the garment in place as inflation occurs to ensure it maintains proper placement. Press the On button again to begin treatment. The vest garment will begin to pulsate at a slower pace, gradually ramping up to the set pressure and frequency in about 20 to 30 seconds. If at any point you should need to pause treatment during a therapy session, press the Off button on the air pulse generator. The vest garment will deflate and the remaining treatment time will be displayed, along with the current therapy settings. To resume, press the On button. Treatment can also be paused using the optional remote control. Squeeze the remote once to pause and once again to resume. If you need to end the treatment session before it is complete, press the Off button twice. When this is done, the inflatable garment deflates and an incomplete screen is displayed. This indicates the remaining therapy time that was left unfinished. Press the On button to continue to the main screen. When you have reached the end of your prescribed therapy session, the pulsations will stop and the inflatable garment will deflate. The display will indicate that your session is complete. Disconnect the hoses, remove your inflatable garment, unplug the pulse generator, and store all components appropriately. The VEST Airway Clearance System Model 105 also offers the ability to program custom therapy modes. These can be accessed by pressing the arrow above Custom on the main screen. Consult with your physician prior to changing prescribed settings. Program mode allows you to create 2 separate therapy regimens, each with up to 8 points with various settings within a single therapy session. The Cough Pause feature gives you the ability to set breakpoints within a treatment session that serve as a reminder to cough, allowing time for the removal of any secretions that have moved to the larger airways. Ramp mode allows you to ease into therapy from a lower to a higher setting within a percentage of total therapy time. For step-by-step programming instructions, please consult your Model 105 User's Manual. The VEST system Model 105 requires no routine maintenance. If needed, clean the unit with a soft cloth, dampened with a mild detergent or disinfectant. Wipe down the components on the outside only, and never immerse the air hoses or the air pulse generator in water or any solution. Avoid excessive moisture or use of harsh cleaners. The C3 washable garment air bladders should be removed and cleaned following these guidelines. Only the outer shell is machine washable. For instructions on how to remove the